All right, let's dive right into this explainer and just completely dismantle everything we think we know about ADHD. For decades, the medical and psychological communities basically believed that attention deficit hyperactivity disorder was strictly a childhood condition, something you just magically outgrow by puberty. Well, recent scientific breakthroughs have entirely shattered that myth. We're now discovering that ADHD is actually a really complex, lifelong neurobiological reality. And honestly, what we've been looking at all these years is just the very tip of the iceberg. So let's start with a massive question that's literally surging online right now. Can you suddenly develop ADHD in your 20s or 30s? We're seeing this huge wave of adults seeking diagnoses, which naturally leads us to wonder, is this a condition that can have a late onset?
Well, the wild twist here is that late onset is actually just late diagnosed. Research shows that genuine cases of late onset ADHD are exceedingly rare, if they even exist at all. What's actually happening is that adults often perfectly mask their symptoms brilliantly through their early years. It isn't until major life transitions, like say leaving for college, moving out of your parents' house, or starting a really demanding career, remove those childhood structures and guardrails. That's when those coping mechanisms finally fail under the pressure.
Section 1. Beyond the childhood stereotype.
To truly get what ADHD is, we first have to define executive function. Think of this as the brain's ultimate command center. It's the cognitive system that figures out short and long-term consequences, plans for results, and makes real-time evaluations and adjustments. Prominent researcher Thomas Brown brilliantly breaks this down into 6 integrated gears or clusters. People with ADHD typically suffer impairments across these specific areas: organizing tasks, regulating alertness, managing frustration, utilizing working memory, and self-regulating action. So the absolute crucial takeaway here is that ADHD isn't just a deficit of attention, it's an impairment of the entire executive management system of the brain.
Section 2. The neurobiology of ADHD.
So what's actually happening physically inside the brain? Recent neuroimaging techniques, like functional MRIs, show a clear dysregulation of key neurotransmitters, specifically dopamine and norepinephrine. And this dysregulation is particularly noticeable right in the prefrontal cortex, which is exactly where those executive functions we just talked about live. The brain is literally struggling with the release, reception, and reuptake of these vital chemical messengers. And this brilliantly illustrates how ADHD is highly biological and, highly heritable. We're talking actual structural changes in the basal ganglia, which handles motor control and cognition. We see differences in the white matter tracts that connect different brain regions. There's even evidence of increased microglial activation, meaning there's a real element of neuroinflammation at play here. It's just a deeply complex physical difference in brain structure and chemistry.
Section 3. The hidden emotional toll.
Now, let's dive beneath the surface to the invisible symptoms of ADHD that honestly cause some of the most silent suffering. You might have heard the term rejection-sensitive dysphoria, or RSD, buzzing around social media. While it isn't in the official diagnostic manual yet, researchers note it's very, very real. Brain imaging studies show that youth with ADHD have increased neural connectivity between the frontal cortex and the emotion-processing amygdala. Because of this hyperconnectivity, perceived rejection or criticism triggers an overwhelmingly intense emotional response.
People who experience RSD often describe it as an absolutely unbearable emotional wound. It's so pervasive and disruptive that pioneering researchers like Dr. Fred Reimer have actually proposed an entirely separate emotional dysregulation subtype for ADHD, because this emotional component is associated with much greater clinical severity.
Section 4. The surprising physical connections. As if the emotional toll wasn't enough, researchers have uncovered a totally bizarre and fascinating physical dimension to ADHD. I know this sounds completely unrelated, but what does joint flexibility, like being double-jointed, have to do with neurodivergence? Well, the data shows an incredible overlap. Individuals with ADHD are an astonishing 4 times more likely to be hypermobile than their neurotypical peers. In fact, nearly 80% of female adults with ADHD have this trait. Crazy, right? The crucial point here is that a genetic connective tissue difference causes the tissue in muscles and veins to become essentially floppy, and this disrupts the autonomic nervous system. Blood can pool in the gut after a meal, meaning the body struggles to pump it back to the heart, which is a condition linked to dysautonomia and POTS, or postural orthostatic tachycardia syndrome. Because this same system manages our fight or flight response, this physical dysfunction triggers heart palpitations, severe anxiety, and intense brain fog.
The mind and body are completely intertwined here.
Section 5. Redefining the diagnosis.
With all these emotional and physical complexities, the psychiatric community is finally being forced to redefine how we diagnose this condition. And this is especially vital for women. Because the classic diagnostic criteria leans so heavily on visible hyperactivity, women, who often exhibit internal inattention and emotional dysregulation, were vastly underdiagnosed in childhood. Because of that, an astonishing 60% of women with ADHD carry their symptoms into adulthood, compared to about 30% of men.
You can clearly see this diagnostic evolution if we compare the two major psychiatric manuals. The US-based DSM-5-TR still relies heavily on rigid symptom counts and requires proof of onset before age 12. But the global standard, the newer ICD-11, takes a much more holistic approach. It focuses on functional impairment across life contexts, and it explicitly recognizes that adults often develop sophisticated masking and compensation strategies that hide their struggles from the outside world.
Because of these evolving definitions and a growing awareness of adult masking, the demographics of ADHD are shifting fast. In fact, the average age of an adult ADHD diagnosis in the US has now climbed to 28 years old.
Section 6. Management and Thriving.
So once the mask comes off and a diagnosis is actually made, how do we treat this lifelong condition? Right now, the first U.S. adult ADHD clinical practice guidelines are actively being drafted to standardize care. Treatment spans a multimodal approach. We're looking at everything from precision medicine, finding the exact right stimulant or non-stimulant, to cognitive behavioral therapy and ADHD coaching. It even includes neurofeedback to train brain activity and, fascinatingly enough, physical exercise like Pilates to strengthen the core and combat the pain associated with that hypermobility we talked about earlier.
And getting that treatment has massive, literal, life-saving impacts in the real world. For example, studies have shown that for an adult with ADHD, taking their prescribed medication consistently actually decreases their risk of an automobile crash by a staggering 40%. It also significantly lowers the risk of substance abuse and workplace injuries.
If you take away just one core truth from this whole explainer today, let it be this. ADHD is a complex neurobiological medical difference. It's linked to your genetics, your brain structure, your neurotransmitters, and even your connective tissue. It is absolutely not a personality defect. It's not laziness, and it is for sure not a lack of willpower.
I'm going to leave you with this final thought. As science finally uncovers the true depth of the ADHD iceberg, recognizing the physical pain, the emotional dysregulation, and the sheer exhaustion of masking, what other neurodivergent realities have we been forcing people to hide just to fit into a neurotypical world?